Have you heard horror stories about the Glucola drink for diabetes testing in pregnancy? Do you want to avoid consuming all of that extra sugar and food dye? Fear not, there is an easy alternative that's accessible to everyone. Welcome back to Every Mama's Midwife. My name is Jess. I'm a certified nurse midwife and infertility mom, and I'm currently 25 weeks pregnant with an IVF pregnancy. Like many of my patients, I also want to avoid drinking the Glucola drink for diabetes screening. This is a test that's usually completed between 26 and 28 weeks of pregnancy because some women will develop diabetes while they're pregnant. Personally, I find the idea of consuming calories that I'm not even going to enjoy spiritually offensive, and this baby has been making me crave all of the things covered in country gravy. I'm talking French fries, chicken fried steak, biscuits. I gotta save those calories for gravy. Most practices will start with a 1-hour glucose test. This is a test that you don't need to be fasting for. Usually you'll either go to the hospital lab or you'll complete it at your doctor's office. They'll give you a Glucola drink that contains 50 grams of sugar, and then 1 hour later, they'll test your blood sugar to see how your body processed the sugar. For reference, 1 can of Coke contains 39 grams of sugar, so it's less than 1.5 cans of Coke. That being said, I don't blame anyone that wants to avoid consuming extra calories, and I know more and more patients are reporting sensitivities to food dye, so some patients want to avoid it for that reason as well. The practice that I work for, and this is standard for most OB practices in the United States, will have patients complete a 1-hour glucose test, and then if they don't pass, meaning that their blood sugar is 140 or higher, we'll have them complete a 3-hour glucose test. The 3-hour test is straight up awful because you have to be fasting for it. You drink a drink that has 100 grams of sugar, and then you have your blood sugar checked 4 times. Fasting, 1 hour after the drink, 2 hours after the drink, and 3 hours after the drink. If 2 or more of those values are elevated, it confirms a diagnosis of gestational diabetes. Some practices will just have patients do a 2-hour glucose test, which is also diagnostic for diabetes if any of those values are elevated, but you do have to be fasting for that test as well. Patients frequently ask about alternatives. A common question is if they can drink fruit juice instead, but the answer is generally no. The issue is that the type of sugar in the glucose drink is dextrose, whereas the type of sugar found in fruit juice is fructose, and your body processes those sugars differently, so it's not a simple one-to-one swap. I also saw an inaccurate TikTok the other day saying that you can just ask for a hemoglobin A1C instead. And a hemoglobin A1C is a simple, quick blood test that looks at what your blood sugar has been doing over the last 3 months. Unfortunately, studies have shown that it's really not good at catching gestational diabetes, which has a more sudden onset. Sometimes we do use this test in early pregnancy, but that's to assess for if the patient had diabetes before they became pregnant. Fortunately, testing does not need to be complicated because there is an easy alternative. If you remember back to last week's video about preventing excessive weight gain in pregnancy, I'll link it here in case you missed it. You can use the handy-dandy over-the-counter glucose monitor that I mentioned to screen for gestational diabetes. I'll drop an affiliate link in the description. You simply check your blood sugar 4 times a day for 2 weeks and keep a log of those numbers. You should check your fasting blood sugar first thing in the morning before you've eaten, and that number should be less than 95. You should also check your blood sugar 1 hour after each meal, and that number should be less than 140. If you forget and you end up testing your blood sugar 2 hours later, then it should be less than 120. Just make sure you document if it was 1 hour or 2 hours after your meal, and I find it's easier if you consistently do one or the other. I personally don't have my patients check their blood sugar after snacks. If more than 25% of your numbers are elevated, then you probably have gestational diabetes, and your provider will likely have you continue to check your blood sugars as well as follow the gestational diabetes diet. I find a lot of the time when I'm diagnosing gestational diabetes with this method, patients will bring their numbers into me and all of their numbers after meals will be good, but then all of their fasting numbers will persistently be elevated. I chose this method for diabetes screening with my first pregnancy, and personally, I think it's way more valuable than the Glucola drink because it lets you know which meals work well with your body for pregnancy versus which ones spike your blood sugar. Some of the results may surprise you. If you want to avoid drinking the Glucola drink, it's certainly a reasonable option, so you can talk to your prenatal care provider about checking your blood sugars instead. This time, I'm trying to see if my insurance will cover a continuous glucose monitor instead, but if it won't, then I will use this method again. I do think it's important to screen for gestational diabetes because uncontrolled gestational diabetes is associated with a lot of poor outcomes. Gestational diabetes carries an increased risk of macrosomia, a large baby, shoulder dystocia, or a baby's shoulder getting stuck after the delivery of the head at birth, more extensive tearing for mom, and even an increased risk of fetal death. Anyone can get gestational diabetes. I've seen it impact super skinny fit moms just as often as I've seen it impact moms who start pregnancy with a little bit of extra weight. I hope you found this video helpful. If you did, please give it a thumbs up. If you have other questions about gestational diabetes or screening tests, please drop them in the comments. I post new videos every week about infertility, pregnancy, and motherhood after 35, so make sure you subscribe and turn on the notification bell so you don't miss an upload. Thank you so much for watching.